Hello everyone. Today we're diving into the world of primary health care, specifically in South Africa. If you're new here, welcome. I'm a medical doctor and health educator. So let's get into it. First things first, what is primary health care? Primary health care, or PHC, is more than just a healthcare approach. It's a philosophy. It's based on the belief that everyone should have access to quality health care regardless of where they live or their financial situation. It has 6 core principles. Equity, meaning everyone has fair and equal access to health care. They are often the most accessible healthcare professionals in communities, making them ideal for educating the public on various health topics. This includes medication safety, disease prevention, healthy living, and more. They also play a crucial role in stock management, helping to ensure that clinics and CHCs have the essential medicines they need to serve their patients. Lastly, pharmacists are instrumental in patient referral. They can identify patients who require specialist care and ensure that they are referred to the appropriate healthcare professional or facility. Accessibility, which means services are available when and where people need them. Their role is diverse. It's challenging and incredibly important in ensuring that South Africa's healthcare system functions effectively for everyone. Thanks for tuning in. If you found this video helpful, please don't hesitate to share it with your friends and family. Until next time, stay healthy and happy. Community participation, because healthcare is more effective when communities are involved. Intersectoral collaboration, recognizing that health is influenced by many sectors like education, housing, and agriculture. And finally, appropriate technology. This means using technology that is suited to the local context and sustainable in the long run. Now let's look at how this works in South Africa. South Africa's healthcare system is a mix of public and private. Most people in South Africa are covered by the public sector, which is primarily funded by taxes. This system has several tiers. The first tier is the Community Health Center, or CHC, and the clinics, which provide basic healthcare services. These are your primary healthcare facilities. The second tier includes district hospitals that offer more specialized services. The third tier comprises regional hospitals, and the fourth tier consists of tertiary or specialist academic hospitals. On the other hand, the private sector is funded by medical schemes and out-of-pocket payments from individuals. This system caters to a smaller portion of the population who can afford to pay for these services. Pharmacists play a pivotal role in the South African healthcare system, especially in primary healthcare. At the PHC level, which includes clinics and CHCs, pharmacists are essential for several reasons. Firstly, they ensure the rational use of medicine. This involves dispensing the correct medication, explaining the correct dosage and duration of treatment, and counseling patients on potential side effects and how to manage them. They also play a vital role in disease management, particularly for chronic conditions like hypertension and diabetes. By providing medication management plans, including adherence programs, they help patients to control their conditions more effectively. Secondly, pharmacists are key for health promotion and education. In essence, pharmacists in South Africa are at the forefront of primary health care, bridging the gap between medical needs and pharmaceutical solutions.